Welcome to your medications for infections lecture. Our objectives are the same. So first one, we're trying to select an antibiotic, antifungal, whatever we're trying to attack against. We need to select our medication appropriately. We don't need an antifungal unless we're fighting a fungus. We don't need an antimicrobial unless we're fighting a bacteria. So we need to know a lot of things before we can actually make this decision. Some things that can help us narrow down and figure out what medication would be best are gram stain, culture, and sensitivity. Gram stain is going to identify what the microbe is. So is it MRSA? Is it E. coli? Is it what type of microbe? Whereas the culture is going to be a smear of that solution or fluid that the microbe is in, and smear it on a petri dish and see what grows over time. This is more reliable or when gram stain doesn't find anything. So if a gram stain comes back negative, then they might still send off a culture and see if anything grows over time. And then a sensitivity is when we take those microbes and test to see what medication, what antibiotic it doesn't like. So we introduce to different areas on the petri dish specific antibiotics and see which area then dies that it doesn't like. So this is more of a trial and error, but can give us very detailed information about what medication is more sensitive for the microbe so that we can treat the infection more effectively. Other things to consider are the client's immune system. Do they have an intact immune system or a suppressed immune system? If they have a suppressed immune system, bactericidal antibiotics are going to be what we want to stay towards and not bacteriostatic. We'll get into those in a moment, the different kinds. Whereas if you have an intact immune system, antimicrobials work along with the immune system, and so it doesn't matter if it's bactericidal or bacteriostatic. The site of the infection is also going to be another thing to consider. Are there barriers to getting to it? Do they have adequate blood flow? Is the infection at a distal part of their arm or their hand or toes? And so then the inflammatory infectious process is preventing blood flow to it. So then a systemic antibiotic may not be as beneficial as a topical antibiotic. So the route may be needing to be changed or be considered in certain infections. Also age. If it's an infant, the antimicrobial may become easily toxic due to an undeveloped kidney or liver systems. And the same thing with older clients, and very easily to become toxic levels of these antibiotics due to a slowed metabolism and excretion. We also can combine antimicrobials, so you're taking more than one antibiotic at the same time. Advantages are going to be that you're going to treat several or multiple types of infections. You can prevent additive infections from forming. There's a less risk of toxicity because you're using smaller doses of each type and using it for a combination effect. And it's more effective than just taking one antibiotic, antimicrobial. The disadvantages, though, is that it's going to increase resistance to the microbial, so you're exposing it to more, so there's more likely that over time that microbe can develop resistance to even more antibiotics. It's an increase in cost, of course, because you're using double the supplies. More adverse or toxic reactions that you need to be aware of. Antagonistic effects can lead to decreased effectiveness, so we'll go over a couple of these that actually you should not combine because combining them inactivates each other. So actually it's similar to just not giving them any antibiotic. So we need to be cautious of that. And then also an increased risk for super infection related to that resistance. Okay, administration of antimicrobials. What are we giving it for? What's the indication? Is it for pre-op to prevent? Is it for an STI or a UTI or another active infection? So are we doing this as a preventative, or because something actually exists and is breaking down the client's tissue? Like, how severe of this infection are we treating? Is it actual, or are we preventing one? We need to encourage the clients to also maintain good hygiene techniques so that they prevent the spread of the infection to their body as well as to others. Recognize risks for infections, such as like a prolonged indwelling catheter, an IV site, cardiac catheterization. Anything that enters and breaks the skin barrier is going to be at risk for infection. An IM injection recently, a vaccination, anything like that can be a risk for infection as well. Then we're going to need to evaluate our effectiveness. So we need to reassess our client. Has the infection improved? And are our blood cultures of the microbe, are they now negative? So usually we'll take a set at the beginning of therapy, and then we will take another set to evaluate the effectiveness of therapy to make sure, ideally, that the culture should no longer produce that microbe. So they should be negative. And then make sure that the clients are completing their full course of their antibiotics or treatment in order to produce their desired effect and to prevent resistance of microbes. So classifications. So the types of microbes that antimicrobial medications fight are going to be narrowed into narrow spectrum antibiotics versus broad spectrum antibiotics. Narrow spectrum is just that. It only harms a very few type of microbes in which that it is sensitive to. Whereas a broad spectrum can harm more microbes. When fighting the microbes, it has either a bactericidal or bacteriostatic effect. Bactericidal kills the microbe cell wall, so like suicidal. So it invades and kills the cell wall, making the cell then die on its own. Whereas the bacteriostatic slows the microbe so that the immune system can kill the microbe more effectively. So this is like homeostasis or stasis, making it slow down, stop. So if the bacteria doesn't replicate as fast, the body's own immune system can then fight it better. So one is directly and one is indirect. Bactericidal medications. We have penicillins. These are going to usually end with that cillin. These are broad and narrow spectrums. We have a high incidence of allergies to these types of medicines and renal impairment. These are going to be your two flagged areas that are very common with these type of medications and need to be aware of and what they look like. What does an allergic reaction look like? What does renal impairment look like? So those things you're going to have to know for your test, know for your clients, and know for your education for your clients. Hyperkalemia, which is a increased potassium level, dysrhythmias, and hypernatremia, which is a high sodium level, are also possible with penicillins. Cephalosporins are going to usually start with ceph. These are broad spectrum, so they can harm many types of microbes. Again, we have allergic reaction and a cross-sensitivity to penicillins. So if they are allergic to penicillins, then they are most likely going to also have a reaction to cephalosporins. So they should not take these either if they have an allergy to penicillin. Renal insufficiency, again here, renal impairment. And then you have your other complications, including bleeding tendencies, thrombophlebitis, especially given through the IV route, pain, of course, because of IM administration, and then diarrhea. So type of infection that can come from taking a cephalosporin includes C. diff. And so if they have a new onset of diarrhea, this could be what is going on, that we have overrun with the C. diff in their GI system and now have diarrhea, and so we need to now treat them for C. diff. We'll get into that in a little while. The next set of bactericidal medications are carbapenems, usually end with penem. Again, these are broad spectrum. Allergic reaction, renal impairment, and superinfection. So this is like another opportunistic infection that comes on, like the C. diff, pneumonia. I'm trying to think of another superinfection. So making sure they have good cough hygiene, good washing their hands so they complete their antibiotics as they're supposed to, education such as those. Aminoglycosides are going to be micins with a Y or an I. These are also broad spectrum. You have the allergic reaction, the kidney issues, but you also have a neurological effects and ototoxicity. Glycopeptides are going to include vancomycin. These are broad, but used for specific ones usually because they can have a high toxicity effect. So we usually only use these if needed. Also have the allergic reaction and renal issues. But then here again, you have the ototoxicity, the hearing loss, ringing in the ears, and then also red man syndrome. This is an infusion reaction. So when vancomycin is given through the IV, this red man syndrome can occur. So I have on your slides these little red stop signs. So these aren't just, oh, it's okay, we'll just slow it down. No, this is stop. So if you see these, then you stop. So if there's an allergic reaction, we're going to stop the antibiotic, flush the IV, get rid of anything that is exposing the client again to that medication. So signs and symptoms are going to include dyspnea, so difficulty breathing, skin rash, pruritus, which is itching, urticaria, which is hives, wheezing, hypotension, swelling, etc. Signs of an allergic reaction. Another stop indication is going to be a superinfection. So if they have colitis, like diarrhea, oral thrush, black furry overgrowth on the tongue, and or a vaginal yeast infection. These are opportunistic infections that have now come on as they are taking an antibiotic, and so they need to stop this medication, this antibiotic, and start a different one. An infusion reaction. So this red man syndrome is so they'll have a skin rash, very bright red. That's why it's called red man syndrome. Very bright red skin rash, pruritus, flushing, tachycardia, and hypotension. Last stop sign is going to be the neurologic side effects. So this is with your aminoglycosides. So if there's developing any symptoms such as respiratory depression, they aren't breathing as well or as effectively, they're slowing down their respirations, anything that can cause them to not breathe effectively. If they have muscle weakness, tingling, numbness, or ataxia, which is impaired coordination, then this could be neurological complications from the aminoglycosides. Bactericidal interactions and administration. With penicillins, you're not going to give along with aminoglycosides. This is where it inactivates. So giving penicillin and an aminoglycoside together, you're not going to treat their infection. You're just potentially killing their kidneys. Also, with most of these, you'll see oral contraceptives. If anyone is using an oral contraceptive, along with most of these antibiotics, they're going to need to use alternative methods of contraception. So make sure you're giving them education to use condoms, to use a barrier method to prevent contraceptive, besides oral contraceptive, those hormones, because they will no longer be effective in preventing pregnancy. So I've actually known someone who have, despite taking oral contraceptives, never missing a day, habitual about it, taking an antibiotic at the same time and ended up pregnant with twins. Okay, it makes the oral contraceptive no longer effective. So it's no longer preventing pregnancy. So these little blue sparkly spot things are going to be, hey, pay attention to. So penicillins are going to need to take with meals because it's going to upset their stomach. These are pretty strong. Cephalosporins, don't mix with alcohol. And calcium solutions can cause precipitate, so make sure that you're not mixing those together in the same site or if you're giving them IV. So you're going to need to take these with meals as well and store in the refrigerator. Carbapenems, if they're also taking valproic acid, monitor for seizures. Valproic acid is a medication for seizures, so essentially carbapenems is going to inactivate their seizure medication. And so remember your neuro effects. Aminoglycosides, like it says in the penicillins, if you mix aminoglycoside with the penicillin, it inactivates both of them. So it's no longer effective. And then if they're taking a loop diuretic, it can increase the risk for ototoxicity, which is that hearing loss. So this is where we need to start monitoring our peak and trough levels to make sure that we're maintaining therapeutic levels of medication. So we don't want it too high, it could be too toxic, and we don't want it too low because then it's not therapeutic. So we will actually draw levels from the patient's blood and compare it to what it should be to determine if what they're receiving and metabolizing correctly is what it should be during that time. So these are specifically timed at and a certain amount of time after administration has occurred. Glycopeptides, like vancomycin, if they're taking a loop diuretic, erythromycin, or aminoglycosides, ototoxicity again. We're going to make sure we're watching those trough levels and peak. All right, bacteriostatic, your cyclines, make sure that you have tetracyclines are for broad spectrums, but you're going to make sure and look for any GI discomfort. So nausea, vomiting, diarrhea, esophageal ulcers. And teeth discoloration or hypoplasia can occur. So we're going to make sure that we're giving them, if this is oral, through a straw, so it's not staining their teeth. And then hepatotoxicity, which is the liver, and then photosensitivity. So this is going to be a sensitivity to the sun, any sunlight. So they will be easily sunburned. So education about wearing sunscreen, protective clothing, hats, scarves, not going out at the peak of the day, things like that. And then again, you have your supra infection. Macrolides, you have examples are going to be your thromycins. These can be bactericidal in high doses, but we usually use those with penicillin allergy. So remember, if you're allergic to penicillins and cephalosporins, then this is your backup medicine for your broad spectrum, but in high doses can be bactericidal. These can, of course, also cause GI discomfort and ototoxicity in high doses. But then here is a new side effect for prolonged QT intervals. So QT intervals are related to the EKG, so the cardiac rhythm of the heart. So it prolongs the rhythm of your ventricles contracting and relaxing, and so this can be problematic and can cause heart failure. So we're going to be monitoring them with a cardiac monitor in this case, at least initially, and definitely for those that already have cardiac issues or cardiac history. Antimicrobials, rifampin is usually the big one. These are specific to treating tuberculosis. These can cause peripheral neuropathy, so tingling, numbness, and burning in the extremities. Hepatotoxicity with the liver, and orange body fluids. So rifampin can cause orange body fluids, such as tears, pee, sweat. All of those turn orange. This is a normal side effect, but you definitely need to educate someone so they don't freak out about this. And they can also have GI discomfort and colitis, so diarrhea. Stop signs. If they have a prolonged QT interval on their EKG, ECG, it can lead to sudden cardiac arrest and death. So you need to stop the medication, get rid of it, flush it out, notify the doctor, and have resuscitative equipment nearby in case that interval gets so long that it just stops. Ototoxicity, so hearing loss, vertigo, dizziness, and tinnitus, ringing in the ears is another stop. Sepra infection, again, with your diarrhea, oral flush, your fury, why do I keep saying fury? Furry growth on the tongue, and vaginal yeast infections. Peripheral neuropathy to the extremities. And then we have bacteriostatic interactions and administrations. First, tetracyclines, we're going to take with 1 hour after or 2 hours before any milk, calcium, iron, and laxatives that have magnesium. So if they'd like to drink milk a lot and they're taking oral tetracyclines, make sure that they have education that to take it away from their milk. So don't take it first thing or take it an hour after breakfast if they love to have milk and cereal or something. You know what I mean? Oral contraceptives, again, so using alternative methods to prevent contraception if that's what they're desiring. And then digoxin. So digoxin is another one that's going to be levels that we monitor very closely. We'll look into that later with cardiac. So taking on an empty stomach with 8 ounces of water. Only take with food if GI upset occurs. So there's your little blue bam. Macrolides. If we are also taking a macrolide with antihistamines, warfarin, or digoxin, we're going to need to monitor their liver function tests and their PT-INR, so their coagulation labs. Started to say exams, they're coags. This can cause them to not bleed like they're supposed to, and so this can be very concerning. So they're already taking warfarin as a blood thinner. So we're gonna, and all of these are gonna also affect the liver. So you have your double whammy with your liver, and your liver produces the PT and INR. So that's where you get your effect there as well. Verapamil, diazepam, and antifungal medications, in addition to a macrolide, is can cause toxicity and cardiac arrest. So make sure they're also paying attention to these things, that they're watching them cardiac monitor, remember, and then also use alternative contraceptives. Take on an empty stomach with 8 ounces of water, or only take with food if GI upset occurs. So they can take it with food, but first direction is going to be take on an empty stomach with water. But if they do that, then they get GI upset, then they can take it with food. But the first line is empty stomach. Okay, antimicrobial. So rifampin, taken with phenytoin, can cause ataxia and incoordination. This is another seizure medication we'll get into later. So again, just think of the electrical activities in the brain. So ataxia and incoordination, they're not really putting two and two together. Also have your liver toxicity with alcohol and pyrazidamide and tyramine. And then you have warfarin contraceptives and HIV meds. Again, you're going to watch your PT, INR, and consider alternative contraceptive devices. Avoiding alcohol with antimicrobials, and take 1 hour prior to or 2 hours after a meal with a full glass of water, and only take with food if GI upset occurs. Okay, other classifications of medications are going to include antiprotozoals and antifungals. So antiprotozoals are like metronidazole. So this is to fight a protozoan. So this is usually Flagyl is the other name for this. This is usually given to treat C. diff. So this is a broad spectrum that we use against anaerobic microbes. This can cause GI discomfort, darkening of the urine, neurotoxicity, and colitis, so diarrhea. Avoid alcohol and monitor their bleeding, coagulation, and the medication levels of warfarin, lithium, and phenytoin. Consider contraceptive alternatives also, again, and take with an empty stomach or with food if GI upset occurs. Antifungals are going to be your nystatin, ketanazole, fluconazole. Those are the main three ones. Amphotericin B is another one. These are treating a fungus. So these are fungostatic or fungicidal. So again, the stasis versus cidal. And can be systemic or superficial antifungal medication. These can have infusion reactions just like others. So observing for any precipitates, we're going to make sure to use a filter in our IV tubing so that it will catch any precipitates, any crystallizations that are occurring before it gets infused into their circulatory system. So a filter is the key one here. Can cause thrombophlebitis, so infection, irritation, swelling, red, painful IV arm. Nephrotoxicity is going to be kidney toxicity. So if we are giving an antifungal, we can also lessen this effect by giving it with a liter of normal saline. And so especially like in older adults that already have some sort of kidney failure, kidney history, but they need this antifungal. So we might need to consider giving them fluids. But if they have severe kidney failure or congestive heart failure, then they may not be so inclined to tolerate that much fluid. So this is a decision that the physician will make. Electrolyte imbalances, bone marrow suppression, and sex hormone changes can occur, as well as hepatotoxicity, again with the liver. So this is especially so with ketoconazole. Can never say that right. And then we have, if we mix these with aminoglycosides, digoxin, warfarin, sulfonylureas, can also cause additional toxicity effects. Of course, as always, consider contraceptive alternatives. Red stop sign, of course, if you have that infusion reaction. So fever, chills, rigors, so like shaking. A headache 1 to 3 hours after the start of the infusion. We can, if we suspect that they might be likely to have this reaction, we can also pre-treat them with Benadryl, diphenhydramine, and acetaminophen, which is Tylenol. Sex hormone changes with these antifungals include gynecomastia, so breast growth. So this is abnormal breast growth. So if they didn't previously have a C cup and now they have a C cup, or they're male and now they have a C cup. So breast growth that is not normal to their development. A decreased libido, erectile dysfunction for men, and irregular menstruation in women. Those are all sex hormone changes that can occur with antifungals, especially ketoconazole. Here are your references. Came from your chapters 43, 44, and 45 in your textbook. Thank you.